The other day, I couldn't remember where I put my keys. Turns out I'd changed purses.
Hmm.
This always happens, and you think, "Oh my God, is this menopause?" Or
Well, so I can find my phone one day and it was in the fridge. And true story. And then if you ask my kids the things that they hate about me, the questions asked, where's my phone
yeah,
and where's my keys?
Yeah.
Because I never know where those are.
And yes, I will admit that there have been times where I had my glasses on my head and I'm like, where's my glasses? And they're like, it's on your head.
we've all done that. Welcome to the Avaaz podcast. We are your hosts, Dr. Madhu, Dr. Nav, and I'm the moderator, Roop. Welcome back for this season of Avaaz. We are the podcast where we talk about health issues that affect most women, obviously most people as well, but we give you a perspective of South Asian women. So thank you for joining us. Today we're talking about dementia. Before we get started, I want to give it a shout out to Jyoti Sandhu, who's been invaluable in providing us with some research, some practical examples of what she experiences through Alzheimer's Society BC. Jyoti is a support and education coordinator for South Asian communities with the organization and has provided us with a lot of information that we'll be talking about. So let's start off. What is dementia? Dr. Madhu.
Dementia, as my kids think I have, but I don't yet. It's a whole umbrella of stuff, but basically you're losing your mental skills to cope with your daily life. So it's not just a bit of memory loss like we've been teasing each other about, but it is where you are actually losing your ability to navigate life. And it gets worse over time. So it's not like one day you're good and then all of a sudden you have a diagnosis of dementia. It's progressive. So it's happening over months. And it's an observation that the person suffering from dementia may not realize they have it. It's the people around you. And sometimes when you yourself are experiencing some symptoms of dementia, you'll feel like maybe, but you lose insight too, I think. So it's a loss of independence. So their brain function and structure is being affected, so they can't do their daily activities. Some symptoms, obviously memory loss, language difficulties, so finding words, which by the way, I am starting to do. So this might apply to me. Um, Getting changes in your mood, your behavior, your judgment, like not being able to judge things properly at times. Uh, Not being able to even navigate like how to cook something that was really second nature to you, or bathing, or remembering phone numbers. So you might have remembered a person's phone number by heart, and all of a sudden you're grasping for what those numbers were. Or uh, yeah, thinking of name of a person. So over time, it magnifies, and then that's what we call dementia, essentially.
I think also it includes like disorientation, like you
Yeah.
walking the same route your whole life, and all of a sudden you stop. And you're like, wait, where am I? Like, which was the direction I came from? Or you might be in a grocery store aisle and like, okay, didn't the milk used to be here? What's it doing over there? Because you forget even common spots, common places.
Or even it also applies to like a time of day. Sometimes you're confused about what time of day it is, or month or year. So yeah, it does affect a lot of bigger and smaller aspects of orientation.
I feel like I've been hearing about dementia more often. I don't know if that's just because our parents are in that age category, 70s and 80s, where maybe there's more cases of it. But is it actually occurring more often, or are we just hearing about it more, Dr. Nav?
So it is actually occurring more often, and that is exactly for the reason you've mentioned, is because we have such a bigger rise in our aging population. So as we have better health, we live to a longer age, and as a result, because dementia is diagnosed more with older age, we're seeing more cases of it. So even like in Canada where we live, in another 5 years, it's estimated that's going to be 1 million people in Canada living with dementia. And another 20 years after that, they're expecting the rates to rise by even like 200% over that. So it's going to become even more common. More and more people we know are going to have it. And it's really going to be a bigger burden on healthcare. And we'll talk a bit more about that later. And the other thing, too, is that women, because our podcast is all about women's health, and the sad note here is that it does affect women way more than men. So in an almost 2-to-1 ratio, women will get dementia more often than men.
So let me repeat that. For every one man that will be diagnosed with dementia, there'll be 2 women that will get that same
The
diagnosis.
men are probably causing the dementia.
That is not medical advice, but
that does lead to my next point.
okay, why? Why are women having more cases of dementia, double the amount of dementia as men?
So it used to be thought it's because women live longer than men, which we've always known. Women do tend to live on average 5 years longer than men. But it is also thought that there could be other reasons. So, for example, women may be more prone to certain genetic risk factors that might be causative of types of dementia. Or women might be more prone to stressors or depression or lack of early childhood education, all of which have been shown to have correlation, if not causation, of dementia.
Really?
Yeah.
Yeah, I did see. I'm learning. I didn't know that.
So correlation versus causation. Correlation means that these things happen perhaps at the same
But
time,
yeah.
but one doesn't necessarily make the
Cause
other one happen.
Right.
Yeah.
So we
Just
don't
to be-
quite know which is which yet, but it certainly is affiliated, correlated, if not causative.
So women have more stress. They tend to be more depressed, and they tend to have maybe lower education.
Mhm.
Wow.
And that's very common in our South Asian culture, right?
Yeah, and many
Okay,
cultures.
and let's talk about it. How does it specifically affect the South Asian culture?
In Canada, by 2050, 1 in 4 of the cases of dementia will be people from South Asia, South or East Asia. I think that goes along with also the population within Canada. Disproportionately, there will be more Southeast Asian origin people, but it's a huge chunk of the population. That's 25%. And again, as Dr. Nav mentioned, double the number of women will be affected. So that 2-to-1 ratio. So I think we need to create within dementia just an awareness culturally of the context that dementia can present in our different culture. And interestingly enough, and I didn't know this prior to preparing for the podcast, is studies have shown that colonization and stress from racism can affect brain health. And I believe that. Because I find
Can you expand on that?
I mean, I think that whenever you have a stressful chronic stress, because I think colonization is a chronic stress, racism is a chronic stress, it's at the back of your mind. I think all of us who grew up earlier in Canada have experienced racism. I've still experienced it as an adult. And I have to say, it does create mental stress.
Yeah,
And I
because
think
it's always at the back of your mind, if
always-
not at the forefront.
yes.
And it's about your safety.
It's about your safety. It's about your sense of self. It's creating a layer of stress that's unnecessary.
Yeah. So that's phenomenal that it can actually almost take place over generations as well. Dr. Nav, you said that dementia is a umbrella term. So what falls underneath dementia?
Yeah, so exactly that. Dementia is used to describe many different forms of dementia. The most common one, the one that most of our listeners will have heard about, is Alzheimer's dementia. And basically what happens with Alzheimer's is that it causes damage to your brain cells over time. So I won't get into the details, but it involves amyloid plaques and neurofibrillary tangles. So basically the brain cells start to get damaged and destroyed, and then that's what leads to your thinking and memory to worsen over time. The second most common type is vascular dementia, which occurs after a series of very, very tiny strokes. Basically, your brain blood vessels become smaller over time, and then they stop giving oxygen and blood to that part of the brain, and so that part of the brain tissue dies. And those series of tiny little strokes causes the brain cells to damage, and then causes similar symptoms to dementia as Alzheimer's does. And that's the second most common. There are other types of dementia that we won't get into because we could spend an entire episode on that, but frontotemporal dementia, Lewy body dementia, even Parkinson's, those can all contribute to brain damage that result in dementia-like symptoms.
But so the outcome would be that all those, whatever the cause is, the results would be the same: the memory loss, disorientation, the forgetfulness, right?
Yeah.
Okay. And what causes some people to get dementia and some people can have a clean bill of health?
Well, there's certain risk factors that we can't modify. One of them being, we've talked about being female. So it doubles your risk of dementia. Advancing age. So as we age, the incidence increases for dementia. After age 65, your risk of dementia doubles every 5 years. And after age 85, almost 25% of people will have a diagnosis of dementia.
Wow.
That's a huge chunk, especially with an aging population. Genetics. So you talked about Alzheimer's. Now, Alzheimer's can be genetic. It's also a very small component. I think Less than 5% of the, no, let me rephrase, Alzheimer's, uh, we talk about it, it's not, it can be genetic, but most of it just happens randomly. So 95% of Alzheimer's happens randomly. Less than 5% is genetic. Yeah. So I mean, there's not age in being a female.
And then are there risk factors that we have some control over that we can actually change?
There are modifiable risk factors, and we always talk about these same things. We talk about controlling high blood pressure. We talk about controlling weight gain or obesity. Physical inactivity can lead to it. Diabetes can lead to it. High alcohol intake, things like smoking, hearing loss, air pollution can also potentially lead to it. History of traumatic brain injury. So if you've had bad concussions again and again, that can also promote your chances of developing dementia. And then along the lines of what we were talking about earlier as to why women get it, some studies have shown that loss of or lack of early education, whether it's elementary school or high school, makes people more prone to dementia. Having depression later in life, so middle age or beyond, makes people more prone to having dementia. And then social isolation. So if you're don't have a vibrant social life, if you don't get out and see a lot of people, if you're not part of a lot of programs in the community, that also makes you more prone to dementia. And so it's important that because these are modifiable risk factors, that we try to do whatever we can when we're younger to modify them so that we have less risk, because there's certain things, as Mother mentioned, that you don't have control over.
I'm just thinking back to the generation of my parents. In a lot of that generation, the women were not sent to school because it was too far and it wouldn't have been safe for them to go. So they would have had probably less education than the men. And then you come to a new country and you have to adjust, and there's so many stressors, and you're trying to make it all work out. So I can see that how the generation of our parents, there is a high incidence of dementia. That's not statistically proven or medically proven, but I'm just
But they have
an observation, right?
They have risk factors for sure.
And that's where the socioeconomic factors come in, and so that's another sort of possibly in the future modifiable risk factor. So if you have, depending on your socioeconomic background, what your finances were like, did you grow up in poverty? What was your family income? What is your race? What is your cultural background? What is your previous health like, your family health history? What is your education like? So all of that makes a difference. And we talked about stress. So elevated stress levels will also affect our body's ability to maintain itself. And that accumulates over a lifetime or multiple lifetimes, right? And then, as you were mentioning, Madhu, racialized or marginalized groups experiencing that racism is also a possible social determinant.
And that brings us to our next point, is that why in the South Asian community, there might be barriers to getting that help, right?
Yeah.
So basically, there's a cultural stigma. Like, do we want to accept dementia? Do we see it for what it is? There's a denial also, not even culturally, just as a loved one, we see them aging. We don't want to see them aging. It's really hard to see a parent age because we remember them in a certain way, and to see them become something else is also traumatic for the caregivers, like the children who then become caregivers. There's also, how do you ask, there's a shame, there's a stigma that, oh, well, I don't want to take them out. I don't, it's okay. I don't want to expose this part of them that's changing. So it's really important to ask for help, to identify that there is a change, and let's try to do something about it. And also, you don't want to isolate that person, by having the shame yourself. So we need to understand what it is. We need to accept what it is. I remember my Dadiji, who was a very highly educated woman, but she had dementia due to hydrocephalus shunt thing way back when. So she had some dementia, and I said to my Dadaji, we were in Chandigarh, I said, oh, let's take her out for ice cream. He's like, no, why would you do that to her? Like, the great doctor lady, why would you take her out in public? And it didn't make sense to me as a child. As I aged, I thought, okay, I see his point, but I still see my point that it's okay. You should still go out in public and let them interact. So the other barrier is ask for help. If your primary care physician sort of not listening to you and dismissing it, it's okay. Ask again. Raise your concerns, saying, well, I don't just think it's memory loss. I can't find my keys or I can't find my phone. I think it's more than that. It's affecting their way of life. Also, it's not a normal consequence of aging. We don't get demented as we age. That's not normal. This is an illness that warrants treatment. Um, and also just ask for help. It's very hard as a caregiver to take on that full responsibility. A lot of areas have care programs that can provide day sort of programs for people. It's important to get them to socialize with their family and loved ones that are familiar to them. What other barriers have you guys seen in your experience and in your practice?
So I think you've basically done a really, really good job of explaining them all. I think the problem is that for us as women, we're doubly affected, right? Because not only are we going to get dementia more often, but we're primarily the main caregivers with family members with dementia. So it comes back down to that sandwich generation topic that we discussed a while back. So it is really, really important for us as women to advocate for not only ourselves when we are getting to the age where we're worried about memory loss, but also advocating for our elders. And we will get into that a little bit further in the topic about how we can help advocate for our elders when it comes to getting help for dementia.
And when I'm thinking about it, there are so many elderly people who maybe have mobility issues, and so they tend to stay home. They're isolated. They're watching TV a lot, or maybe they're watching the grandkids. And what ends up happening is, if they are dealing with dementia, they're not getting the interaction or the socialization that they need. And to your point about not wanting to take your WG to get ice cream, like, it would be fine for her to go and get ice cream. If you think about it now,
If you
to
think about it
see
now,
people,
yes.
talk to people,
That is what low-key
of
can give the whole
course.
thing,
Yeah.
right?
Yeah.
And you're afraid that that person might say something embarrassing, or, I know of an occasion where this woman with dementia met a relative and said, "Oh, how's your husband?" Well, she'd been divorced for a few years already, right? I mean, but luckily the woman understood that the elderly person had dementia.
Yeah,
And
so
so it's
the
very
intention was not
important
it wasn't
to think about the
intentional. You have to
intention.
think about the intent.
Exactly. So, are there ways to diagnose dementia? Because I'm thinking, as we were talking about earlier, we've lost our keys sometimes. We put things in the fridge that don't belong, or you go
Yeah.
upstairs to the bedroom and like, what did I come here for? So, how do you know it's dementia and not menopause, or just
How do you
too much,
diagnose
too many
it?
things
Yeah,
in your head?
good question.
Well, there is no real single test. A lot of it comes from a family member or yourself thinking, okay, I really am having way more issues with my memory than I should be. I need to get this checked out. So then you go to your primary care provider who will do like a physical examination to make sure there's no other reason. But also there's a special memory test that they will administer to you. It's like a spoken and written test. And they ask you questions like, what time of day is it right now? What year is it? They might ask you to draw a clock face. They might ask you to remember
Recall
a few
objects,
words.
yeah.
Yeah. So it's a very specific memory test that's scored, and then they use that as a baseline. So over the years, they can repeat the same test again and again to see how you do. So that's sort of the initial ways of diagnosing it. And once they've made that diagnosis, then you can get referred to a specialist in elder care called a geriatrician or a geropsychiatrist if you're having behavioral mood issues. Um, and so things like blood tests for Alzheimer's, there is a blood test that's available. But as far as I know, I think it's only available in the US.
I think
Perhaps
so.
it's coming to Canada,
Yeah,
but not there
yeah,
yet.
I agree.
But honestly, like if you think you have, I mean, if it walks like a duck and talks like a duck, it probably is. So if you're having memory issues and you're not doing well on this memory score, it probably is dementia. Whether or not it's Alzheimer's or another kind, the management is going to be exactly the same. So it doesn't really make that much of a difference. And then there are medications that we would prescribe for people going through dementia which will help them to delay the onset of further memory loss, delay the loss of independence for a few months to years. There are medications that we can prescribe that would help with mood changes that are often found with dementia, behavioral changes, like, for example, if someone becomes more aggressive by nature, so it will help them deal with that. And then meds to help them with their sleep, because oftentimes you'll have a condition called sundowning.
Yeah, right. It's a disorientation of day and night. So when it's nighttime, they'll wake up. So it's very disruptive to the whole house and disruptive to the person suffering from dementia.
It almost sounds a little bit like they become childlike, where their mood is maybe a little bit more erratic, or they get angry easier. They can't control their emotions, and they're sleeping opposite schedules.
Yeah.
So you have to manage all of this. You have to keep them safe too, in terms of leaving the stove on. things like that. So there's a lot to manage with people with dementia.
Absolutely.
And I think along with the meds, we've talked about the importance of just being social.
Yeah.
Right?
Yeah, for sure, for
Yeah.
sure. I was going to mention one thing that I came across in my research, and that's the role of supplements to help improve your brain health. And one of the things we talked to, or I looked up, was vitamin B12, and so that's possibly a cause or possible cause of dementia, but
A cause of dementia?
not necessarily a cause, but something that might make your brain health worse over time. So if you have a vitamin B12 deficiency, then perhaps you would be a candidate.
So the taking B12 is not going to cause it.
No.
The lack of B12.
Yeah, so only if you have a known deficiency.
Okay.
Similar to the previous episode, we talked
Yeah.
about supplements only when you need them.
Yeah.
But one interesting thing I found is the role of possible creatine. And right now, creatine is used to help improve body muscle health because it helps provide energy to high energy organs like muscles. Well, the brain is also a high energy muscle or high energy organ. And so there have been early studies that have been done on the role of creatine to improve brain health. And it has, in early studies shown some effect on improving memory, improving cognitive performance. So there perhaps is a role for it in the future, but right now it's not approved by Health Canada. Don't go running out and buying it just yet, but it is coming down the pipeline. And I think there will be some more studies on it that might show it has some improvement in helping prevent loss of brain health.
It's pretty interesting, though, that dementia is a disease that cannot be cured.
Yeah. That's
So you can
important.
slow down the progression, but you will eventually have the same outcome, whether it's a shorter time period or a longer time period.
Unfortunately, yeah.
Yeah.
For now, there's no cure.
Yeah. And so you've talked about some meds to help with some of the mental health, the mood, some of the behavior. And would they also be prescribed meds for depression?
Yeah, that's another thing that can help. So depression or any sort of mood disorder, whether it's aggressive mood or a low mood. Yeah.
Okay.
Also, just to reemphasize a simple thing, I'm not saying this will cure dementia, but to help, hearing aids. I find a lot of people in our South Asian culture don't want to spend money on hearing aids.
No.
Oh, it costs $2,000. What's the point of the $2,000 if you can't hear anything? Right?
Yeah.
So even though it costs, I think it's worth it because it gives you a sense of normalcy that you can at least hear. So I do urge people, if you can't hear, to really investigate if you will benefit from a hearing aid.
Because that's a form of social isolation as well, right?
And unfortunately, I do see it a lot more than I would
And
like.
so many, I find, older people don't want to wear hearing aids because they say it amplifies certain sounds, and other times they just turn it off. It's too disruptive. But I think it's just a matter of getting used to it. So aside from this medical intervention, are there any things that you can do or that can be done that are non-medically to assist?
Yeah, I mean, there's a lot of medical, non-medical stuff we can do. I think it's really important, again, socialization, so important, and especially with people who are familiar. So a lot of people who do suffer from dementia remember people from earlier on in their lives. So it's important maybe to have that connection. Also, obviously, exercise, proper nutrition, the usual
Stuff we always say,
stuff we
right?
say about everything.
Eat well, exercise, yeah.
And day programs. So it gives the person who's caring for you, gives them a bit of a respite, relief, so that they're fresh to interact with you later on. And it gives the person with dementia a sense of purpose that they're doing something different, sort of exciting.
Yeah, and also helps to get them out of the house for some care for respite as well.
Yeah.
And a few other things, like if you like doing brain exercises, then like do word puzzles, do Sudoku, do crossword puzzles, read a book if you're not used to reading books, or if you love reading, then try reading a book in a language that's not as familiar to you. So if you're used to reading in English, try a book in Punjabi, or try if you're the other way around. There are also lots of programs at recreation centers that are available for just small fees, especially for seniors. And here in BC, where we live, there's an organization called PICS that has classes for seniors, and they teach them things that like they would never have done before, like how to use a computer, like how to send emails. So we have in our culture, we have a lot of elders that say, "Oh, I'm old now. I'm retired. I don't need to learn a new thing." Well, this is exactly why you need to learn it, so that you don't end up with dementia. That you could have had some way of modifying the risk factor for that by keeping your brain healthy.
So exercise your brain.
Yeah.
Keep it active.
And then something that I know when you have somebody who has dementia, and I've seen this happen, and it's easy to sort of be like a parent to their and see them as a child and say, don't do this, don't repeat that, just it's fine. I already told you, I'm not going to say it again. But what we have to understand is the person who has dementia doesn't realize
Well,
they
they don't
asked
have
that question
insight.
again.
They don't have the insight.
They don't realize they've asked you what the time is 5 times. How do you approach a person with dementia, especially if it's someone you're living with?
I think with a lot of patience, and not to correct them because they're not doing it intentionally. So you're correcting them, you're getting frustrated, they're getting frustrated, nothing is going to be achieved by that. So a lot of patience, try to connect with them, and also give yourself a break too. Like if you are getting overwhelmed, this is when we've talked about day programs or having other family members come in, and it has to be a very coordinated effort to keep someone with dementia healthy and the caregiver healthy.
Yeah, and I like that saying that Jyoti was actually telling me about: connect, don't correct. I thought that was really helpful, just along the lines of what you're both saying, to make sure that you're connecting with a person rather than getting everybody more and more frustrated. And then, if we want to talk about other tips for how to help a person living with dementia live as normal a life as possible, if you're worried about them getting lost, you can also, you could put air tags on shoelaces, on keychains. You can have a lock on the door that's like a combination lock. So if you're worried about them wandering off at night, if you have this lock on the door with a combination code, then they can only access it during the day, or you can have it so that it sets to lock at night. You can have special programming on stoves so they don't turn on at nighttime. You can have cameras set up in home, so you can, even if you're not there physically, you can look at how your relative with dementia is doing. Are they able to close the door? Are they moving around? Are they able to mobilize? All that kind of things that you can do to help their lives be easier, and also your life as a caregiver be easier.
And we have to remember that dementia is going to progress. It's going to get worse. So what works today may not work in a month, right? And you have to keep adjusting and trying to sort of stay on top of it, for sure. So we've been talking about how the older you get, the more likely it is to have dementia. But I know there was this movie, what's it called? Something Alice?
Oh, Still Alice.
I didn't watch that. It sounded too depressing.
But it was about a woman who had early onset Alzheimer's. And I just watched a Hindi movie called The Three of Us. And
I saw that.
Did you see that?
That was beautiful.
Beautifully shot.
Really
film.
beautiful. Highly recommend it.
Yes. And it was about a woman who had dementia, and she goes back to her childhood home. And
her partner was so loving and supportive.
That was an example of how patient you need to be with a dementia patient. And she wasn't elderly.
No.
Right?
No.
So you can develop early onset dementia?
You can develop what they call young onset dementia, early onset dementia. And that's defined as people under 65 years old. So more people in their 40s to 60s are getting diagnosed with dementia. Maybe that's just better diagnosis techniques, maybe more awareness. There could be other factors. They account for 3% of dementia cases in Canada. By 2050, the study estimates that there could be a surge of 187% to 40,000 people under the age of 65 living with dementia in Canada. And the most common type of young onset dementia is Alzheimer's. So again, we've talked about seeking treatment. You have the symptoms, we might say, you're just forgetful. It's menopause or something, but pursue it. If something just feels off, you don't need to feel dismissed. You can say, I understand that this is what you said to me, but this is a bit more than normal forgetfulness. So an example would be some people living with young onset dementia, learning a new system at work, they end up having a really harder time. So you can start getting little signs and stuff. So you do need to sort of pursue that. Some couples will find that in their relationship, the other person's getting more delusional. Just very change in behavior that is not who they married. So that could be one reason. There can be other reasons. They can be mental health reasons, but you don't want to just dismiss it as mental health. That is something that also needs to be explored. What else am I missing?
Menopause.
No, I talked about menopause. Yeah. And it's stressful because basically you're getting diagnosed at the prime of your life. So it affects your ability to earn money. It affects your future. It affects your retirement. It affects your relationships. So it's really important to seek a diagnosis so that we can seek treatment.
Mm-hmm. And it's really important to have a family or a partner who is observing these changes, but is patient enough to say that you need help. And I understand it's not you, but this is what I'm noticing, and probably not something you can control. So let's get tested.
Yeah.
So our focus of Oz is South Asian women and obviously our South Asian community. So what are any barriers to South Asians receiving help for dementia diagnoses?
I think just seeking the help and just the awareness of what is dementia. So if you are not aware of what it is, then how are you going to seek the help? So I think the podcast today is to make you aware of what dementia can look like, and then just to seek the help.
Mm-hmm. And then also in terms of, cultural differences in ways that people living with dementia, how they are dealt with by others. So for example, just to give you a few examples. So if you get home care as an elder and you have someone that's not trained in the culture that you live in, like say you have someone that comes in to help you, do make your lunch, but they don't take off their shoes because they don't know that's part of your culture, or they don't remember to put out something like your a jar with your roti, maybe you're having your lunch. So that would be one thing. Or they don't speak your language. Like when we have dementia, we revert back to our first languages. And so we may not have as good a grasp of our new language as we did when we were younger. And so if you have a caregiver or a health care worker that's not as proficient in your language and they're only speaking English, that's going to make your language barrier even harder. And there's also some stereotypes that South Asians will always care for their elders, and so primary care providers may not offer resources for them, right?
And so the burden is left on them, and that's not good for the provider or the patient, right? Because you're burning out.
At some point, though, like you can take care of the elderly person with dementia in your own home, but at some point they will need care that's beyond what you can do, right?
And so that's also an issue. Like some people do have to go to long-term care, and culturally we're a little bit more resistant to that. So even though it's not good for the patient, we are so resistant because of what people might say, our own guilt that we're not providing proper care. But honestly, that's just it. We can't provide proper care. It's actually very dangerous. At a certain stage of the dementia progression, they will need perhaps long-term care, and it's okay. You don't have to feel guilty about it.
Yeah, I think that's a really important point. And I think that's been taken into account more and more because more and more of these long-term care homes that are now developing this model of what we're calling dementia villages, which sounds kind of weird, but basically it's a way to ensure that people living in these homes are free to move around and it's a very structured, very familiar environment, very safe. But now they're doing it with cultural context in mind. So there's ones that are being developed specifically for the South Asian community or other communities so that they can feel that they're in a familiar scenario.
Yeah, because then you can have the food they're used to, the language, the people working there could look like, somebody that is from their community. It would be so much easier for them to fit in and adapt. And when you have dementia and you're in those further stages, you probably don't even remember all of your relatives. So if they come to visit, you may or may not know who has come to see you. So as long as you love and you respect and you want to take care of your elders, like you said, there shouldn't be guilt about getting them the care that they need because it's about them, right?
Mm-hmm.
Yeah. So this has been actually a topic that we've wanted to touch on for some time, and you've done a lot of research. So any final thoughts on dementia?
Well, I'm going to leave you with a bit of a different final thought this time, and it's about the caregivers too. Sometimes what happens is the caregivers, especially when it's an elderly married couple that I've seen in my practice, they do such a beautiful job. So they do the connect, don't correct, they do everything, but they're losing themselves in the stress. So I think it's really important to also take care of yourself as a caregiver and allow yourself to help your partner or your loved one, but make sure that you're taking care of your own mental health.
That was very beautifully said. I'm just going to follow up with something a little more pragmatic.
Sorry.
So I was just going to say it's okay to have this diagnosis made for you or for your loved one. Please don't be worried about the stigma because it's becoming such a common not disease, but a common issue now in all communities. It's not the end of the world. With early intervention and with the help of your primary care providers, medications, you can delay the onset, delay the progression, and live a really long, fruitful life. So that's great. And the second thing I was going to say is along the lines of what Madhu was saying earlier, that whatever is good for your heart is good for your brain. So do your brain exercises. Don't sit around saying, I'm older now. I'll let my child do all the work around the house. I can just sit here and watch Netflix and my dramas all day long. Get out there and use your brain. Keep it healthy for as long as possible.
Yeah. Go for walks, talk to your friends, socialize, eat well. And I think, that's the best you can do. That's in your control,
best
right?
you can do.
Yeah. Well, thank you so much for tuning in today on the episode of Dementia here at Avaaz. We hope you've learned a few things, can share some information with the people that you love. Please share this podcast episode with the other women in your life that you think might find it useful. And you can find us on Instagram, Facebook,
YouTube,
TikTok, YouTube.
You can find us everywhere.
Yeah, and you can listen to us on Spotify and Apple Music. Please DM us with any questions, any suggestions you have for future topics, and we would love to hear from you. Thanks again for listening. And a reminder, this podcast is no substitute for advice from your own doctor. Take care. The information in this podcast is not a substitute for professional medical advice, diagnosis, or treatment.